All right, 5:26 on this Wellness Wednesday. Welcome back. Exposure to air pollution is linked to a rise in rheumatoid arthritis. A study in South Korea found that dust, soot, and smoke can both cause and worsen arthritis. The study's authors say this is a significant finding because the levels of air pollutants are rising worldwide. The research also suggests it's possible to lower the risk of arthritis flare-ups by avoiding poor air quality. THC can have a benefit for people suffering from PTSD. That's according to researchers in Germany that found that THC, the active ingredient in cannabis, reduces dream activity, which could help nightmares associated with PTSD. More than a third of patients treated with THC reported no more nightmares after about 10 weeks. But the authors of the study say more research is needed. People with eczema may have a higher risk of developing shingles. A study of people in the UK found individuals with eczema had a 28% higher risk of being diagnosed with shingles. And the worse a person's eczema, the higher the risk. Researchers say using immunosuppressants medications to control eczema did not have an effect on the shingles risk. Well, August is National Immunization Month, raising awareness about the importance of vaccination for people of all ages, that is. And for the first time, the leading group of doctors for pregnant women has released an immunization schedule for patients that differs from federal vaccine recommendations. Here's Bradley Blackburn.
Dahlia Romero is in her third trimester. Before her baby girl arrives, she's receiving the Tdap vaccine, which will protect her and her newborn against tetanus, diphtheria, and pertussis, or whooping cough, until her baby is old enough to get the shot.
I'm very open to whatever it's provided to keep my baby safe and myself safe as well.
Tdap is among the vaccines recommended for pregnant women in the 2026 maternal immunization schedule from the American College of Obstetricians and Gynecologists, along with the flu, COVID-19, and RSV vaccine. It's the first time ACOG has released a schedule different from federal vaccine recommendations, which no longer include COVID.
Pregnant women should know that these vaccines are tremendously safe. Vaccines prevent diseases. These viruses can be worse if they're transmitted during pregnancy. And most importantly, newborn babies are vulnerable to infection.
With national guidance changing and vaccine misinformation circulating, the goal of the new schedule, endorsed by more than a dozen medical organizations, is to address recent confusion for both doctors and patients. Dr. Erica Banks is with NYU Langone Health.
My personal feeling is any questioning is fine. What concerns me more is the trust in physicians and the science behind these vaccines. We just need to continue to speak about the data that's out there, about how safe it is.
Dahlia encourages pregnant women to talk to their doctors like she did.
Don't go based off other people's opinions. Do research, because that's what I did.
And she's grateful to do what she can to keep her family healthy. Bradley Blackburn, CBS News, New York.
Well, that schedule also includes additional vaccines for those with certain risk factors for patients who are postpartum and breastfeeding.